If you have sciatica and your leg pain is worse in the morning, do not get out of bed the next day until you watch this video first. There is a reason why sciatica leg pain flares up the moment you try to move and get out of bed in the morning. And it has nothing to do how you slept that night or your sleeping position. It's about what you're not doing before you get out of bed, before you stand up in the morning. And this one mistake fires up the nerves that contribute to the sciatic nerve before your body is even ready to handle any load as you stand up. So I'm going to give you 3 exercises to help with this. And these 3 exercises will take less than 5 minutes. You can do them in bed while you're lying down before your feet even touch the floor. And if you do them consistently every day, every morning, you'll notice a real difference in how your mornings start to feel, starting this week and maybe even as early as tomorrow morning. Watch right to the end because exercise number 3 is one of the most powerful sciatica relief exercises, and most people with sciatica have never even been shown this. Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And on this channel, I share tips and strategies on how to help people relieve pain from chronic spinal conditions like disc bulges, disc degeneration, bad posture, scoliosis, stenosis, and also help people improve their posture and live a full and active life again. So if you're new to my channel, welcome. Hit the subscribe button right now so you never miss a video. And let me know that you subscribed in the comments below and I'll reply right back to you. Now, why does morning sciatica get worse, or why does it feel worse in the morning? Here's what's actually happening to your spine the moment you begin to wake up. So during the night, your discs in your spine are actually absorbing fluid. It's a process called imbibition. It's a completely natural process, but it also means that your discs are becoming more pressurized with that extra water hydration. In the morning, especially at the point when you're about to get up and put load on your back. So if you have a disc bulge or a disc herniation in your lower lumbar spine, those nerves that come out of your lower lumbar spine that contributed to the sciatic nerve, that extra pressure begins to make those nerves more sensitive, more inflamed, more reactive. Then you add tight muscles, stiff joints, and a nervous system that's just not warmed up yet to take this load and this effect. And then you have a perfect storm to create a painful morning full of inflammation in your back and even in your leg. So that's why these exercises that I'm about to show you exist. I'm going to give you these exercises that will help with this, and do them in the particular order that I show you because it makes a difference on how they all stack up. Now, here's something that's important to note before we dive into these exercises, before you even try them. These exercises, these movements, they're designed to relieve your pain. But if you have more pain or discomfort by doing these movements, then you need to stop immediately. They're not designed to increase pain. We want the pain to decrease. So if the pain's going down into your foot, right down to your leg, then you need to stop. And it's always best to consult with your personal doctor, chiropractor, physiotherapist before you start any particular exercises. So let's dive into exercise number 1. This is called the knee to chest activation. And I like to start with this because you're lying down in your bed already. It's the first exercise that will help this whole process go. So you're waking up, your lumbar spine, it feels tense, your lower back muscles are tight. This is a great way to relieve the pressure off those lumbar nerves that are triggering that sciatica leg pain. You can follow along as well if you like. As you're lying on your back, you bring one knee up towards your chest. So use your hands, grab your thigh right where your knee is, and just pull it towards your chest. And you should begin to feel a nice, comfortable stretch in your lower back, even around the gluteal area. I always tell my patients to hold this for 10 seconds. Hold for 10 seconds, get a good release, and then do that 3 times on that one side. And then again, switch sides. So 10-second hold, 3 times for each side. You should feel like there's a release in your lower back region, not a discomfort. What this exercise is doing is gently flexing the lumbar spine just a bit, enough to create a small amount of space between those spinal joints. And that will reduce that morning compression on those nerve roots. Those nerve roots exit the spine, then feed into the sciatic nerve in your buttock area. So think of it as a window opening up that lets that pressure out around those nerves. And once that window's open, the next exercise will get this to go even a little further, the effect of this release. And this exercise is called the figure 4 piriformis release. It's exercise number 2. Now, here's something that most sciatica patients don't even realize, is that the sciatic nerve will actually exit and run directly from under the buttock area, where the piriformis muscle lies, deep in the glute area. So in the morning, that muscle is tight, right? You're not moving around as much. It's not warmed up. And when it's tight, it compresses or irritates the sciatic nerve, even if your disc is not the primary problem causing the actual leg pain. So this exercise will help release that piriformis muscle around the sciatic nerve even before you're standing up. So again, you start by lying on your back, bend your knees, and then you cross the right ankle over your left knee, creating a figure 4 shape with your leg. Then gently press your right knee away from your body, so you get an extra stretch in there, and very slowly and comfortably grab your left thigh and pull towards your chest. So you're stretching the right piriformis muscle. You should feel a deep stretch in that right glute area, that right hip area. Again, hold this for 10 seconds, do 3 reps on that one side, and then switch sides. Hold 10 seconds and do 3 repetitions on each side. Always go slowly, steady. The piriformis muscle responds to sustained pressure, not aggressive stretching. If you feel any sharp pain or any shooting pain down into your leg, just stop this altogether, or you can actually relieve that range of motion. Don't stretch too far, okay? Now, those 2 exercises prepare your body, give you a lot of relief in the morning. But the next one is the one that makes the biggest difference in the morning, and most people with sciatica have never even been shown it. This is exercise number 3, the sciatic nerve floss, and you can do it again in your bed as you're lying down. The sciatic nerve is the longest nerve in your body, and just like the muscle that sits in one position all night, it can become shortened or tightened or even sensitized by the morning. Nerve flossing gently mobilizes the sciatic nerve so it can glide freely through the surrounding tissue, the soft tissue in the area, those fascial sheaths that surround the nerves. And this can really help reduce that morning nerve irritation. So again, you're lying on your back. This time both knees are bent. You're gonna straighten out one leg along the bed. Okay, so one leg is straight. Slowly raise that leg, keeping it as straight as you can. And as you lift, flex your foot and pull towards your shin. Hold that for 2 seconds right at the top, pull towards your shin, and then lower the leg down and point your foot down again. That's 1 repetition. Again, do 10 repetitions on each side. The movement is smooth and controlled, and you may even feel a pulling sensation along the back of your leg. That's normal. Any little mild tingling can be normal as well too, but if there's sharp shooting pain, we don't want that. If that happens, just stop. And what this exercise is doing is sliding the sciatic nerve through the neural sheath, the neural canal, and the surrounding soft tissues. Gives a lot of relief along that nerve. Now, each repetition reduces the adhesions and the tension along the nerve pathway. Over time, this restores the nerve's ability to glide freely, which means less irritation, less pain, and significantly more mobility when you finally stand up. So all of these 3 exercises work synergistically. So do them in order. Now, here's your bonus tip. How do you get out of bed without triggering any sciatica leg pain? Let's talk about that. So after you finish these 3 exercises, do not sit up straight up, okay? Roll to your side first. Let one leg drop off the edge of the bed and use your arms to push yourself up. Okay, this is very important. It's called a log roll technique, and really protects your spine compared to flexing, and bending your back. So you avoid any sudden compressive forces that can immediately spike that nerve pain right down your leg and just basically remove all the work you just did to help relieve it. Take at least 5 seconds to stand up properly with this log roll. This small habit can change and make a measurable difference for you in the morning. Now, if you do these 3 exercises every morning before your feet even hit the floor, you're gonna start changing how your nerve system is responding to the day and how your leg is going to begin to feel. There'll be a tremendous amount of relief that you may begin to feel. You're going to reduce the inflammation around the sciatic nerve and even those lumbar nerves that contribute to the sciatic nerve. And you're going to give your body the chance to function the way it's designed to. That's really important. Sciatica does not have to define your mornings. Surgery is not inevitable. Consistent corrective movements done the right way can turn this around and give you a lot of relief. And it starts right here in your bed, even before you start your day and even before you get out of bed. Now, I want to hear from you. Which of these exercises gave you the most relief? Was it the sciatic nerve floss or the piriformis stretch? Drop a comment and let me know. I read every comment and I'll do my best to respond to as many comments as possible. And if this video helped you, subscribe to it right now. Join my YouTube channel, my community. Follow me on YouTube. Every week I share tips and strategies on how to help people protect their back, relieve pain from chronic spinal conditions, improve posture, and live a life that's full and active again, which is what we want for all our people. And if you know someone who wakes up every morning with sciatica leg pain, like this video, share it. It helps YouTube to send it out to more people, and share it with your family and friends. It could genuinely change someone's life in the morning and throughout the day. And if you want to go deeper on sciatica relief, watch this video next. Right here, over here. It covers 3 standing sciatica stretches that you can do during the day at work when you don't have your bed to lie on to do the lying down exercises. So go watch this video next.